A US House of Representatives Appropriations Subcommittee approved a 6% cut to the budget for the U.S. Department of Health and Human Services for fiscal year 2026. And the Republican bill does reject some of the Trump administration's proposals to slash the budget of the National Institutes of Health. But it does make dramatic cuts to the budget for the CDC and other health agencies. It's a $108 billion budget proposal, $7 billion fewer dollars than fiscal year 2025, and a far cry from the proposed $31 billion in cuts that the Trump administration proposed back in May. This budget draft also does preserve some of the agencies like Head Start that were originally tapped to be scrapped. Let's look at what else is included in the bill. Like we said, funding is preserved for the National Institutes of Health. There is $48 billion set in the budget for that agency. The CDC funding is reduced by 19%, and they also say they're going to streamline 35 programs they call duplicative and controversial. It entirely eliminates the AHRQ, the Agency for Research and Quality. $12.3 billion for Head Start is in the budget. That's maintaining the same level of funding they got last year. And it also calls for a $4 million increase for home and community-based supportive services. Let's do a quick rundown of some of the other funding initiatives in the HHS budget. $515 million for rural health, including increased funding for America's rural hospitals, $1.36 billion to strengthen the health workforce, a $6 million increase for programs under the Community Services Block Grant Act, and it maintains the $1.85 billion in funding for primary health care, which supports community health centers. Also increases funding for mental health and substance use block grants. It provides a $10 million increase for the low-income home energy assistance program, which was good to see because originally that was also set to be eliminated. The bill would also allocate $100 million to the Make America Healthy Again initiative, which the committee says would help Health and Human Services invest in prevention and innovation programs for rural communities, telehealth resources for chronic care, and nutrition services. It also does some renaming. It renames the AmeriCorps program to the America First Corps and renames Workforce Pell Grants to Trump grants. The Appropriations Chairman Tom Cole says this bill supports President Trump's efforts to safeguard taxpayer dollars, eliminate out-of-touch progressive policies, and end the weaponization of government by eliminating or reducing more than 100 programs. The bill now goes to the U.S. House Full Appropriations Committee. It needs to then pass the House and Senate, and some are skeptical if that can happen, and certainly are unsure what's going to happen by that September 30th government funding deadline, which is looming. We link to the bill in the description below.